Cynthia Tieche with Dr. Tieche here on Coffee Talk with Dr. Tieche. So how are you doing today?
Good? Fantastic.
Good. Well, Mother's Day is coming up. Hint, hint.
So is Cinco de Mayo.
Oh, wait, is that
Saturday?
Saturday, which is when this is going to be on live on the radio. So happy Cinco de Mayo. So let's talk about a couple things today. Of course, we're going to hit on weight loss. We're going to talk about thyroid. We're going to talk about patient compliance. I want to talk about my ladies' talk night that I had last Friday night and how that went and what we talked about and all that fun stuff. So last Friday had ladies' night at Recharge Clinic. We had almost 30 women there. It turned out really, really well. But then I thought, I guess if you say, hey, I'm going to talk about weight loss, I'm going to talk about sex, and I'm going to give you free wine, it's not hard to get people there. So that's what we did. It went really good. We talked quite a bit about weight loss and lots of tips and lots of ideas on what to do to just help lose weight. And actually, I did not know, I didn't plant these people in there, but I did have a couple patients of ours that are current patients, and I was going over, this is really kind of neat. I was going over all of my weight loss tips and what, if you do these things, you're going to lose weight, people. And one lady's like, actually, I tried all of those things and I still didn't lose weight until I came here. And I'm like, oh, okay. So what made you lose weight then if you tried all of them? She's like, Dr. Tieche, he fixed my thyroid. And I was like, I promise you, everyone, I did not pay her to come and say that. I didn't even know she was a patient here, but it is true. There's so many things that you can do, and you really should lose weight if you're doing these things. And if you don't, it could be thyroid, and we're going to talk about that later. But then we talked, after I had given my spiel about weight loss, and we had some good conversations, I was like, any questions about anything else before we move on to the next topic? And no one said anything. And I'm like, did you all really just come here to talk about sex tonight? And I think they did. We talked about, not just about sex, we talked about how to get your drive back as a woman, because it's all about men and men's clinic and men having sex drive. But hey, if your lady doesn't have any sex drive, you still
are out of luck. You're out of luck.
You're out of luck.
Yep.
So it is really important, and there are a lot of things that women can do for that. Of course, testosterone therapy is simple, but there's so much more than that. Diet has a big part of it. Exercise raises your testosterone levels, which is one of the main sex hormones. But then there's so many supplements, actually. What DHEA is good, if you haven't tried that. Someone told me, is it maca that you had told me to put on there? But someone actually said yesterday, oh, maca root. Isn't that a root?
Correct.
They said, that really helped me. And I said, yes, I just actually was telling my ladies to try that. That's really great for sex drive. What were some of the ones? Well, vitamins, supplements like arginine and carnitine. What were a couple other supplements that I had on there?
Well, I think in addition to supplements, there's really a whole bunch of other stuff as far as women are concerned that help. Setting the mood, de-stressing.
Yes, we talked about that.
For husbands, I think it helps, or significant others, whoever they may be, it helps. A lot of times women are delegated to most of the household duties, and
so don't make them clean the house anymore, people.
No, I didn't say that, but maybe help a little bit, because if you get done eating and you trot off into bed, take a shower and lay there and wait
and read a book and be like, come on, honey,
I'm ready, and she's
you're gonna get evil eyes,
cleaning the kitchen, putting the kids to bed, giving their bath, and now she's exhausted, probably not going to seem as interested as you are. So you may want to kind of help with some of those tasks to lighten the mood. And even though we might, as men, not think that's very arousing or sensual, I think your wife or significant other might think that is, when they've got to do it all the time. That might be a little bit of a mood enhancer for them, as simple as that is. And it really just helping with everything.
So true. So true. So maybe for Mother's Day, you could swing by the Recharge Clinic and get some Scream Cream for your lady.
What is Scream Cream, by the way?
You're the doctor. It is, I do know, it's arginine. Well, it is a cream. It's arginine, and isn't sildenafil in there?
Sildenafil is. Sildenafil, yes, the Viagra.
Oh, Viagra. Okay, I
Yes.
wasn't sure. So
Arginine,
tadalafil is
carnitine,
Cialis.
yes, and some other little vasodilators are in there. And it's a cream that, when applied topically, increases blood flow. It can be used on men and women, but it's primarily used on women, and it helps enhance sensitivity. So it's an augmenting.
It's nothing you can find over the counter.
Absolutely not.
You would have to go to, well, I guess, just I don't know where you'd have to go. We have it. I don't know where else you would.
Well,
get
you'd
that.
have to get
a prescription.
Yeah, you'd have to probably get a
Take it to
prescription to a
compounding
compounding pharmacy, and if they made it, they would make it for you. But yeah.
Yeah, well, and it is exactly that. It's Scream Cream. You can actually look it up. There is some information on the web about it. But but diet and exercise are a big thing to do with women's libidos. They really are. But about diet, are we done talking about my ladies in it? Can I move on?
Absolutely.
Okay. So I always like to give a diet tip because who doesn't want to lose at least 5 pounds? Pretty much everyone. So a very, very important tip, which everyone on our Recharge diet is told to do this, and if you do this, even on your own, you're going to see better results, is keeping a food diary. Whether you're someone who likes to write stuff down, you want to get a book, or getting my MyFitnessPal app, that is so big. If you write stuff down, you're going to be more aware of what you're eating, how much you're eating, or maybe how much you're not eating, because throughout the day, if you are a busy person, you're not paying attention, or just it adds up. And everything that you stick in your mouth, whether it's a drink, candy, food, if you write that down, you will really have a better idea of what you're doing right or wrong. And anyone who's trying to figure out what may be bothering them as far as allergies, that really helps also, because then you can kind of look back and see what you ate and maybe if something was bothering you.
Well, along those lines, it's interesting because the people who have the most difficulty doing the food diary or food log are the people who are the busiest. And the busiest people are the ones who cheat the most. So it really is a kind of a catch-22 type thing. I mean, so if we could even make any, whether you just make some kind of a tab that to remind yourself that you put something in your mouth, because at the end of the day, you're not going to remember because you're going a million miles a minute and throughout the day just shoving little things in your mouth here and there for nutrition and not keeping track of them. So the people who have more time honestly do a better job, but the people who have less time actually need to do it better. And so it's kind of one of those things that you have to be really cognizant of and really try and do a better job of, because that's where most people fail. It always seems to be that's the biggest thing in dieting.
But these apps, MyFitnessPal is just the one that I'm familiar with, but there are several other ones, but they make this way easier. They will remind you. They'll say, hey, you didn't log your breakfast this morning, if they know. So it doesn't have to be that hard anymore. It's not like writing it down. It can be easier, and that is huge in helping you lose weight, really, if you're not. Another big thing that I want to talk about was realistic goals. So I can speak for myself, and I know most people feel this way too. If I decide, okay, I'm going to lose 5 pounds, I'm going to, watch what I'm eating and diet a little bit. By lunchtime, I feel like I'm 10 sizes smaller. And then when I get on the scale the next day and nothing's changed, what the heck? Really, but that's totally unrealistic. So how many pounds how many calories are in 1 pound?
3,500.
So 3,500 calories. I know we talked a little bit about calories last week, but just as a recap, I mean, we shouldn't even be eating 3,500 calories in a day. We don't burn 3,500 calories in a day. If you're very active, maybe you burn 2,500, maybe. So if you're dieting and eating 1,000 calories a day, which is pretty low, think about how many days is it going to take you to actually burn off 1 pound? Several days. So if you lose 1 to 2 pounds a week, that's about what you should be losing. That's right. That's okay. If you're not losing any pounds a week, then that's a problem. But 1 to 2 pounds a week is healthy. That's a realistic goal. So if you have 50 pounds to lose or more, you're like, oh crap, that's a long time. Yep. It is a long time. You have to stick with it and not get frustrated and have realistic goals. It didn't come on overnight. It's not going to come off overnight. And if you have unrealistic goals, you're going to get frustrated and you're going to quit. You have to really map it out and look at how long you really do have. If you have to lose 50 pounds. How long is it going to take you losing 1 to 2 pounds a week? Now, in your first week, if you really start hardcore, you're going to lose more than 1 to 2 pounds. You should. Most people do. Some of that's water weight and just your body kind of freaking out a little bit. But after that, 1 to 2 pounds a week is exactly what you should be losing. So take the time to map that out and not get frustrated with it.
I agree.
So we kind of discussed thyroid, and I want to go into that, and that's a big subject, but we can talk about it and continue after the break, whenever that might be. I put this thing on Facebook. Wait, I want to read it because it's funny. Well, I think it's funny. About thyroid being the fault of everything that's going wrong in your life, which
could be. Pretty much.
And no one really understands thyroid, unfortunately, but we're going to give you kind of a brief overview so that you can understand it a little bit better. If I can find my post. Everything is thyroid's fault. Fat, thyroid. Tired, thyroid. Broke AF, if you know what that means. Thyroid. Life falling apart, thyroid. It's all thyroid. But really, thyroid does have a lot to do with a lot of stuff. I mean, really, you could probably blame I could find a way to blame thyroid on all of those. Just like I could find a way to blame pretty much everything on you.
Exactly. Yeah. So it is important, really, because thyroid problems affect approximately 50% of the population currently. And so that's a lot. That is a lot of people. So, we see it quite often. We see people, a skewed population, of course, because people are coming to us already suffering from low thyroid and all the ramifications of low thyroid. So they already feel bad. So, but most primaries and most internists and OB/GYN are seeing these same people. They just choose to treat it a little differently or not treat it at all. And that's where the rub happens, really. That's where the friction happens. That's where the total lack of understanding happens, because thyroid is so crucial. It's such a sensitive organ to us. It definitely is a delicate mechanism. It controls our metabolism, so that controls how much calories our bodies are burning. So when it gets offset, the amount of calories we burn goes down, so it becomes very difficult to lose weight. It becomes very easy to gain weight. And many people have experienced that. They say, listen, I diet, I hardly lose anything. And then as soon as I eat a little bit, I gain weight. Well, that's a red flag right there. That doesn't mean everyone that does that has low thyroid, but let me tell you, if your ears don't perk up when someone says that to you, you're not paying attention. The other thing is I have no energy throughout the day. I mean, I wake up tired. I'm tired all day long. My hair is falling out. My skin is dry.
A big one.
It's a big one.
Huge.
These are just such common symptoms of low functioning thyroid that this is basic medical school information. It's sad that most doctors, when they hear this stuff, will draw a panel of labs and just say, you're fine, there's nothing wrong with you. I almost think that doctors have always been worried about having robots practice medicine or having other people practice medicine. But in a way, I almost think they would do a better job than most of those people, because these guys are not really doing anything. I mean, to look at a set of labs and not compare them to a patient's symptoms is crazy. And so not to say, really, how do you feel with these labs? The answer would be horrible. So we're going to step off to a break, and this is a subject I'm passionate about, so I will definitely come back and talk about it.
Tieche with Dr. Tieche on Coffee Talk with Dr. Tieche. I'm from Ocala, Florida. So we were just discussing thyroid and how it's just not, people that are having issues just aren't really being diagnosed correctly with it, and why, and well, anyway, we're going to come back to where we left off with that.
So I was explaining about how physicians are not correlating lack of thyroid or low thyroid symptoms with low thyroid findings in a patient by just using screening labs as the way they treat people. Honestly, if that's the way they're going to treat patients, they really don't even need to see any of them. They don't need to have them come into the office. They could just say, send me your labs, I'll treat you over the phone, and I'll send you a bill. Because that's really how insensitive some of that is, honestly.
Yeah, because they're not listening.
They're not listening to anything that anyone says. And the funny thing about it, or really, it's not funny, it's actually quite insulting. I see these patients, I'll make adjustments to their medications. They will feel amazing. They will start losing weight. Their hair will stop falling out. They might have another visit with their primary, and their primary will say, there's nothing wrong with your thyroid. Why are you taking this medicine? Not a very good imitation of a doctor, but and so the patients go, get freaked out and think they're taking a medication for no reason, and just, lo and behold, they don't know what to do because I've told them to take it, and their primary, who they've gone to since they were 10 years old and has never read a book since he was 10 years old, tells them to stop, so they stop. And then, of course, guess what?
Like
in a month, they feel like crap again, and they start gaining weight, and the whole process repeats itself. So I just challenge these doctors to really read about thyroid and low-functioning thyroids and really kind of educate themselves, as opposed to telling the patients something that they may have learned in med school. Because honestly, I remember in med school, we didn't really spend a lot of time on low thyroid and treating patients who had low thyroid symptoms. So it's very poorly understood about what to do. They're used to treating high blood pressure, high cholesterol, and peripheral vascular disease, and this is something that is not considered a major medical problem to them. It's not a real disease. It's not something that you're going to die from. But let me tell you, it is as significant to the patients that we see as anything else, because their lives are crappy. When someone has a low-functioning thyroid and they have no energy and they can't wake up in the morning and they can't function throughout the day without drinking either lots of coffee or energy drinks or some kind of stimulus to get through the day, they're forgetting everything. They feel like they have Alzheimer's and they can't lose weight. You tell me that's not a significant problem to that patient. It is. It's huge. Yes. And it warrants more than just a blow-off. It really does. And so that's my frustration with it. If you can sense my frustration, it's there.
It is frustrating.
Because it's not so much that, they may not want to take care of it. That's fine. But I am taking care of it, and they should just allow me to do it. But, the truth is other hormones as well, and we'll get onto that rant in a minute.
Yeah. So what they're doing most of the time, I think, is looking at someone's TSH.
That's the most common thing that's looked at, TSH. And that's a screening lab. Anyone would know that's a screening lab. Screening. End of story. That's like just, not even really putting much effort into it. Thyroid, TSH is thyroid stimulating hormone.
So
it's not even a thyroid hormone.
Right.
It's a pituitary hormone that tells the thyroid to make thyroid.
So for people who are listening, if you have felt crappy or couldn't lose weight and you went to your doctor, I'm sure you got your labs done. I'm sure he probably didn't sit with you and explain it all, but you could probably get a copy of them. Take a look. TSH is probably on there. But go on and talk about why are they looking at TSH, and what more should they really be looking at?
Well, in the perfect world, a TSH should correlate with all of those lab functionings. The TSH stimulates your thyroid makes T4 as a hormone, has 4 iodines on it. That goes around and becomes T3, which is the active form of the hormone. They should look at all of those levels, because much of the issues happen, what we say, downstream. Yeah, your brain is telling your thyroid to make the thyroid. That's typically not the problem. So that hormone level is normal. Sometimes even your thyroid is making a normal amount of thyroid. So if you look at T4, that's where 90% of the practitioners stop. They look and say, oh, that's normal, that's normal. But if they looked at T3 or thyroid antibodies, they would see that they were, showing that there's low thyroid function. And when you put that together with symptoms, and this is the most important correlate corollary here is put them together with symptoms. If someone comes in and they say they have a cough or a runny nose or a sore throat, I guarantee that most of those doctors are going to put people on antibiotics for a sinus infection or a sore throat. They're not going to sit there and do 15 lab tests and say, your lab tests say you're not sick. Meanwhile, the patient's hacking and sputtering. It makes no sense. And this is the thing. If these people have these symptoms and they are debilitated, it is a debilitating problem. Make no mistake. It is a life-altering problem for most people, that they deserve to be treated, and they deserve a little bit more time than just being blown off and saying that those your labs are normal, you don't have those problems. It's pretty much a kick in the keister to those patients, because it makes them seem like, one, I don't have time to listen to you. Secondly, whatever you're saying is insignificant because it can't be real. And those things are not true. They're not true. If we didn't see this over and over again and see such dramatic responses with how patients feel, I wouldn't be so concerned about it, or even spend much time about it. It does suck
that it just sucks because I feel bad for them and we care about our patients, that every patient walks in, and when they can't lose weight and they're having all these symptoms and we talk to them, hey, let's look at your thyroid. Yeah, my doctor looked and said everything was normal. Every person that walks in. And then we say, well, bring us the labs. We'll look at the labs that he looked at, and they're not testing all of the thyroid that he's talking about. They're only looking at maybe the TSH. And then when we look at what's actually going on, we see it. And it's every patient. It's terrible. So you might be listening going, yeah, I have those symptoms, and I talked to my doctor and he said the same thing. Well, take a look. What did he look at? And maybe have someone else look at them if he is not willing to take the time to understand them.
Absolutely.
I guess.
And educate yourself. You guys,
yes.
Look up the symptoms of...
It is confusing. What he just said is confusing. TPO, TSH, T3, T4. It's like, whoa, wait, I am lost. You're probably lost. That's okay. But do one of two things. Either read about it, really, really, really educate yourself so you do understand it, or go to someone who really, really understands it. Because if your doctor looked at one thing and said, you're fine, whatever, you're getting old, whatever, that is not the case. You don't have to feel that way. They're not looking deeply. They don't know enough about it.
Yeah, everyone's got a smartphone. Everyone has instant access to the
easily read
internet.
about this.
Look up hypothyroidism and the symptoms. Those are symptoms that I guarantee that you will, if you have those symptoms and been told your thyroid is normal, put 2 and 2 together for yourself. I'm not making it up. It's just what it is. It's a very frustrating thing, and I feel bad for the patients that are put in the middle of it.
Yeah, because they don't know who to believe. They're confused, and it is sad.
It's a very common problem. That's why it's so much out there. I mean, like you said, half the population is affected by it because our thyroids are affected by so many things. Stress in our life. We have a stressful event happen. You go through a divorce, a death in the family, a child leaves to go to college. These things are super common. You have some financial distress. You have a kid. These things happen to all of us all the time. And every person, almost every person will tell me, after this blank, I had trouble losing weight, whether it had been a surgery, a death, a divorce, whatever. And they said it's earmarked to them, and that's usually what happens. Their enzyme deiodinase, which is just an enzyme that converts this stuff, is easily suppressed. Now, sometimes with time it comes back, and that's what we're hoping for. But in the meantime, there's no point in anybody suffering with these symptoms. And so, we try to do herbal support and put people on low gluten diets and things like that to try and help. But in the meantime, the only treatment is to just fix it temporarily, get them feeling better, and then them with proper nutrition, proper exercise, proper rest, which now they're able to get because they feel better, things start to correct themselves. And that's one thing that people ask, am I going to have to be on this forever? Well, some people yes, some people no. And it's really just a waiting game to see if that enzyme corrects itself. But it's very easily suppressed by those things. The other thing that easily suppresses environmental toxins, and we are exposed to them. I don't care how good you think you're doing by eating clean. It's impossible at this point. 10 years ago, it was a possibility. 20 years ago, it was very easy. Now it's impossible. Everything is pretty much contaminated. All of our food's contaminated, even organic foods. Water sources are not. I mean, if you drink water out of a well, you have a pretty good chance of not getting contaminated water, but you never know because there's been leaching into the ground of pesticides, heavy metals, and really even E. coli. So we have to be careful about what all of this stuff. So, nothing is going to be, I mean, everyone's drinking this. There's leaching out of the plastic water bottles that causes that. There's no perfect way to get around it. There's no place to go anymore so that we can't have any exposures. So what we have to do is make the best of it and really understand that these problems are going to be here, and not just turn the other cheek and say, well, this is just what it is. They're easily, remedied. They don't go away quickly, but they're easily remedied. In other words, that means that there's ways of fixing them all and trying to make things better.
So let's say someone is listening to this and they can't make it to the doctor for a little while, and they want to know, what can I do at home to start the treatment? Is there anything that you can do at home without going to a doctor to get your thyroid back in order?
Well, the most common things are, really trying to eat clean, really trying to help your thyroid function better. Many people are not taking any vitamins at all or any supplements. And so we already know that our food supply is depleted, even if you eat organic foods that are supposedly, grown clean. They all have contaminants, but also they don't have the same food nutritional value. So we want to eat that kind of stuff. We want to take supplements, particularly supplements that support our thyroid. Iodine, selenium, chromium, those things are all thyroid supportive, and they're going to help to help our thyroid heal itself. We also want to take things that are going to help us detox ourselves a bit from the contaminants that we've gone in. So there's two types of detoxification. There's colonic detoxification, which, gives you sort of a colonic cleanse. But then there's more important, the secondary one, which people neglect, and that's more liver detoxification. And that's taking stuff because our livers are the great filter. They take care of everything. All of the exposures to stuff, it goes through there and filters it. And so when we start feeling fatigued, tired, having joint pain, all of these kinds of things for no reason, probably we're getting a spillover of toxins that our liver is not able to metabolize. So the thing that we want to do is kind of put everything in our favor. Limit the exposures of these things. Stop eating as much processed foods. Can't go out, you can't not eat any of it, but try to eat as little as you can. Try to eat clean, refined sugars. All of these things, we want to cut them down. And then supplements, things like glutathione, milk thistle, chlorophyll, all of these things help restore your liver and help it function properly, because these things are depleted all the time. Glutathione is a powerful antioxidant, and it is in our body, and it's used up like crazy. So you almost can't get enough of it. So those are the things that you can do at home, in addition to getting plenty of rest, drinking plenty of water, things like that.
So I want to talk about iodine. You mentioned that iodine with selenium and chromium, is that the three? Yep. That's very important for your thyroid, right?
Absolutely.
And you can find that over the counter, can't you?
Yeah. Yeah. So if you were to look in vitamin supplements, there's many of them that you might just buy them all separately, but there's a lot of companies that kind of package them all together that way, say, thyroid support supplement or thyroid care or something like that, and they already have them all together, so it makes it even easier for you to do. Now, there are some people that have to caution that, they have problems taking iodine. There are people who have certain thyroid cysts, that if they take iodine, those might get bigger and they might feel bad. But that's a very small percentage of the population. So it's kind of worth the risk of most people taking it for those few that don't have it. The other thing, when you take iodine, if you've not been taking it, and if you're very deficient in it and you have a lot of bromide in your system, it may cause you to detox that bromide, which is one of the things that contaminates these enzymes that have iodine in it. Bromide will displace it, and we want to displace it back with the iodine, so basically pushing it off. And so when that bromide is released into your body, some people get kind of aches and pains and chills, and they almost feel like they have a flu for a day or so. But the important thing is to bear with it and continue on, and that's how you're going to, get maximum benefit from these supplements.
Iodine alone can really, really help with energy if you're having that thyroid issue. I know I can feel the difference in taking it. And you can, like he said, go to your local health food store and find these vitamins. We do carry them at Recharge also, but look into them, educate yourself. That's really what we're trying to do, is educate people and motivate you to educate yourself a little bit more, so you don't have to take our word for it. Look it up and read about it, because you will see all of it all of this information out there. You done with talking about thyroid? You got more?
No, I just want to say that really, I do a lot of review courses, and I can tell you that no matter what the problem is, I just did an advanced sexuality course for women, which we were just talking about now. And interestingly, the things that we talk about correcting are correcting hormones. But the first thing that all of these people talk about is correct someone's thyroid, correct their adrenals, then correct everything else, because they're that important. Without having those things functioning properly and you feeling well, guess what? You're not going to feel like doing much else. So it's not, it's no, there's no on and off switch. Guys would love for there to be an on and off switch with their wife or girlfriend, on, off, and we're good, but that's not how it works. We have to we all have to kind of take care of ourselves from top to bottom, from inside to out, and really make ourselves be much healthier. And guess what? Everything is going to be benefited from that, just from our daily outlook on life and how we approach things. Because that when you feel crappy, you're in a bad mood. You just don't feel like putting up with stuff. And we all have stressful jobs. We all have to listen to crap all day. And so that just helps when you feel better. It's easier to tolerate that. And go home, you have the same problems. Much easier to tolerate when you feel better. So these things are all important. We tend to forget that, but it's very important to actually take time and restore ourselves.
It's not a quick fix, like one time you're done, you're feeling wonderful again. It didn't happen that way, and it's going to take a little bit of time to fix it. It may take a few visits, and we talk about it like, hey, it's no big deal. Why are these doctors not treating this? But you definitely don't want someone treating your thyroid who doesn't know what they're doing either. And I know that pretty much they put most people on Synthroid. Everyone's getting Synthroid, but Synthroid is not right for everyone. And I don't even know if you ever write that for anyone, actually.
Never. I've never written it once.
No. But I mean, anyway, make sure you're going to someone who actually knows these things, not just kind of guessing or, hey, I just picked this up and hey, I can treat your thyroid. Yeah, I can do that. No, you need to make sure that they do know what they're talking about, and with all hormones, because it's pretty important to make sure that you're doing these things right.
And now, on the other thing, I've kind of beat up doctors pretty good about it and healthcare providers. I mean, now I kind of want to beat up the patients a little bit as well. So one of the things is compliance on their end too. A lot of times we'll get patients who are doing really well on their thyroid, feel great, and they just stop taking it. And they go, well, I felt great. I didn't need it anymore. Well, you felt great because you were taking it, and now you stop taking it and you feel bad.
Or they just feel good and forget to take it.
Right. And so that's important that, you have to do your part too with all of these things. They're not just, sometimes medications are a one and done. You take it and you don't have to take it anymore. But many times these are things that have to be done over periods of months or maybe even years. So if you just get your one prescription for 30 days and you take it, it's not like a course of antibiotics. You're not done with it. You're going to have to keep on with it, because really the initial benefit you feel is really the minimal. Honestly, you continue to improve over time. So, people feel like, well, I didn't see a big improvement. I only saw this a little bit. I'm not going to take it. Well, guess what? You haven't even given any of it a chance. You've lived 30 years with, this low hormone. Now, in 30 days, you want it to fix itself. Well, it doesn't always work that way either. So a lot of this stuff takes fine-tuning. It takes compliance. In other words, being consistent with taking your medicine and giving your provider feedback on how the medicine's working.
Yes.
Because guess what? We're not mind readers. If you tell me everything's fine, but then tell someone else it doesn't work, well, then guess what? We can't fix it. So it does require a lot of adjustment. I know with what I do, everything takes a lot of fine-tuning and adjusting. And once you get there, you want to stay there. You don't want to either just stop therapy abruptly or make some alterations into it, because you're just not going to feel good again. And so that's a really big part. And it's not just necessarily thyroid, it's with your supplements and stuff like this. I mean, these are some lifelong commitments to healthcare and health improvement that we have to make. People know about the virtues of exercising and eating good. It's not just, well, I ate one salad for lunch, so now the rest of the time I can eat crappy. We know that doesn't work. We didn't say, I would love for this to be, I worked out once, so I don't have to work out anymore. But that's not the case either. We know that we have to keep doing it. So if it works in that compartment of your life, and that portion, then it's got to work, and we have to do it in the other ones. And that's the hardest thing for people to remember, but it's very important.
Well, a lot of people will go on vitamin supplements or come get the vitamin IVs or vitamin shots, and they're like, well, how long do I have to take vitamins for? I'm like, until you die. Vitamins are just, you shouldn't be getting these in your food and not need supplements, but unfortunately we don't, and we do need supplements. So I don't know, as long as you want to feel good, you could keep doing this, and then when you give up on life, then I guess you stop taking it. I mean, it is a forever thing. Maybe not every treatment we're doing is a forever thing, but taking vitamins, working out, eating healthy, like taking care of yourself, this is until you basically give up on life, I guess, or you die. So it's not that it's going to be as intense and going to the doctors all the time and trying to figure out what's going on. Once we figure out what is going on with you and we get a little system down, we do routine checks annually or twice a year, and we just keep going as long as you're feeling good. But yeah, it's not a one and done. This is definitely, you have to keep going. You have to be a good patient, and that is what he is really trying to get at, is being a good patient, being compliant, and really going back to what we talked about earlier. Someone may see their primary, they're not happy with what their primary is doing, so they come to us. We get them on a good plan. They're feeling good. They go back to their primary. Their primary says, oh, stop doing all that. They stopped, and they come back and go, I don't feel good anymore. I mean, that is not being a good patient at all. At all. You've got to pick, who are you going to? I mean, you can still go to your primary, but he doesn't do functional medicine. So if you're coming to us for functional medicine, then you're going to continue that. And wherever you may be going, it's the same thing. You don't want to keep having multiple people treat one thing. That's not safe, and it's not a good thing. You're not going to have a good outcome out of that.
Particularly when they have conflicting ideas.
Yes, especially when they don't believe in the same things. Definitely not a good idea. So patient compliance is so important, but I really believe in educating them, and that helps with compliance, is if you understand. I know I take a lot of supplements orally. I mean, I get vitamin IVs. I am all about it. I've always been very health-minded and into feeling good. And I don't know, it's really not hard for me to remember to take my supplements, because I know what's going to happen if I don't take them. If I'm not taking my vitamins every day when I wake up, then I know how I'm going to feel. So I don't have to think much about it, but I am someone who's very into it, and I get it. And so maybe once you start feeling good and you are educated and understand what's going on, it won't be so hard for you to remember, why am I doing this? Why am I taking these? Why am I working out, eating healthy? All right, so we're going to go to a break, and then when we come back, we'll finish talking about a few more things. Tieche here with Dr. Tieche on Coffee Talk with Dr. Tieche, and we've just been discussing all types of medical things today. Talked about thyroid, weight loss, patient compliance. We talked about just all kinds of things. And we're going to finish up today talking about our acoustic wave device that we just got. We talked a little bit about it last week. It's good for so many things, and we've been using it, and we love it. So originally, we found this because we were looking for more treatments for erectile dysfunction, right?
Correct.
And this is amazing for erectile dysfunction. But then we realized it's really great for many, many things. So one of the things, which I put a video on this week, which has had quite a lot of views because this is a huge topic for women, is cellulite. It's really, really great for cellulite. It's great for bursitis, fibromyalgia, any kind of muscle pain, plantar fasciitis, all of those things. It's really exciting. And it does not hurt. It is painless. It's a really, really neat little procedure that we're doing. So let's talk about which one of those did you want to talk about? Did you want to talk about?
Well, so we got our device this week. It's our low-intensity acoustic wave therapy. And so what that means is it uses sound waves. It generates sound waves, and those sound waves go deep into the tissue to cause healing, basically. So it's used to treat a lot of stuff. We've treated several people's back pain this week with like fibromyalgia and myofascial pain, just treating their rhomboids in their neck, and you just go over that several times and several treatments, and it's pretty amazing how good it feels for and how it does not hurt as far as the treatment, and how the yields are so good afterwards. We did do a couple of cellulite treatments this week as well with it. And it was interesting how they found out that it worked for cellulite treatment, because what they were doing was they were treating patients in Europe with bad tendinitis, hamstring tendinitis, thigh tendinitis, all kinds of muscle soreness. These physical therapists were, and what they noticed at the end of these people's 3-month treatment or 3-month rehab, that these people had a noticeable reduction in their cellulite in their legs and in their hips. And so these people were so excited because, one, their legs felt better, but they also noticed that they had much cellulite. So they wanted to go back and continue to get treatment. So these guys didn't know really what to do, but they started treating people for that as well. And so it is painless. That's one thing that's very important to know. There's a lot of other things that are out there for cellulite, the fat freezing and lots of fat injections. Those all kind of hurt a bit.
Those are more specific, I think, for size and inches.
They
I don't
are,
think
but they all hurt.
But I don't think they're really good for cellulite.
Yes, they are. Yes, they are. Yeah. So mesotherapy is definitely.
Mesotherapy
is. There was the VeloShape, which came out, which worked on it, sucked the tissue up and kind of beat it in this little vacuum machine and heated it and sent it back out. And the idea was to disrupt all these little fibers that were in there of the skin puckering with the cellulite to help break them up. But none of them really work that effectively. So, along come this, and it's very interesting. It's very painless, very easy to use, and there's no downtime, there's no bruising from it.
It's pretty exciting because cellulite is
everywhere. It's everywhere. It's rampant.
Sucks. No one's happy about that. So if we could find, I'm pretty sure that women would pay any amount of money if something was going to fix your cellulite. So it's exciting that we have this, and yeah, all the ladies in our clinic are pretty excited about using it. So let's talk about how this helps with shoulder pain and bursitis and these other things.
So the way
it's doing.
So typically what it's doing by this sound wave therapy is increasing blood flow to that area. And that's really how most things in our body heal everything. It's by increased blood flow, removing toxins, regenerating tissue, things like that, causing regenerative growth. So when we go over muscles, the muscles are tight. They have a lot of toxins, a lot of lactic acid that's built up in there. By this thing, sending these sound waves through there, it causes these muscles to relax, releases those toxins, and generates increased blood flow to help heal that area. It works very well for biceps tendinitis. That's in your shoulder. It also works for, trochanteric bursitis, which is on your hip. Plantar fasciitis, which everyone knows about. It's on the bottom of your foot. Heel pain, Achilles tendinitis, which is the back of your leg. These things are difficult, and And so, a lot of times, and why we look for other treatments is, initially they might be treated with a steroid shot, but we can only do so many steroid shots on a tendon, because what happens with it is the first time the steroid shot gets rid of some inflammation, and that's fine. You do keep doing repeated steroid shots, it's going to start breaking down that ligament or that tendon, and that's going to cause that now to be much weaker. So that's the problem we're already trying to take care of, is that it's weak and it hurts, or it's stretched, or frayed a bit. And so by keep doing that, guess what? You're going to have a tendon tear, and then you're going to have surgery to have the thing put back together again. So most people will only inject these things once, twice, maybe, and that's it. So that's why we look for other forms of treatment, such as PRP, platelet-rich plasma, to help these tendons heal. But now also we can add this acoustic sound wave to increase blood flow, to increase your body's natural healing of these areas without putting more steroids in there, which, although work a little bit, are very detrimental to the local tissue. So that's the idea. That's why you can't do it on people's feet. Those steroid injections on people's feet over and over again, or their Achilles tendon will cause these things to break, and that's very serious. So it works very well by that blood flow. For erectile dysfunction, it works the same way. Basically, low intensity to that area most of the time. What it will do is increase blood flow, increases sensation, increases a lot of problems that exist here, because that's a big problem with erectile dysfunction, is blood flow. And in conjunction with PRP and other therapies, it basically reverses a lot of this stuff and helps the healing process go on naturally without any external medications or anything else.
So, how many treatments does someone need for these individual different types of things, like cellulite or?
Well, they all vary for sure, but we like to do at least 2 treatments a week, and at least we try to space them out. Some, it depends really. Some you can have to treat up to 6 weeks for those areas to get that type of improvement. It's not.
So it just depends really on the person
depends,
and
yes.
where they are and how severe it is. And okay.
Fortunately, they're not expensive and it's not painful. So someone could come during, prior to work, get it done, and go right to work, because it's not going to be something.
Yeah, there's zero downtime
that you have any pain with, so that you can't, function with after, or you gotta, there's really no precautions that you have to take with that.
That's awesome.
We were meeting with some chiropractors today, and they talked about how they use that quite a bit in their treatments, and they were excited that we had this form of therapy, because it's they know very well how effective this is for treating muscular pain and joint pain and things like that. Yes. So it's kind of an exciting new addition to the Recharge family, so to speak.
Yeah, I mean, everyone's always looking for some way to feel better, and so it is neat to have one of these. I don't think anyone in this area has anything like this, and it is affordable. It's definitely affordable, and there's packages that you can get to make it more affordable, because you are going to need it more than once. I mean, for erectile dysfunction, you recommend a few weeks of it, right?
Correct.
And then I guess just depending on how bad their ligament or tendon injury is, would decide how often they're going to do it.
Correct.
And probably do a little maintenance program once you're done. And
yeah, and that's how most of the things are treated, is really because everyone has varying degrees. To say everyone's going to get the exact same thing, well,
it's not a one size fits all.
Some people are minor, some people are severe. So
that's very cool. So would you use this in conjunction with PRP?
Absolutely, that's the best way of using it. I mean, in addition to other modalities or other forms of treatment, depending on which you're trying to treat, but definitely adding things on there, particularly all natural things, that have no downside, have no risks with them. That's what we want to do, is to really kind of take the advantage and use our own body's healing properties to help fix all of this stuff. And that's the way to go. So that's the future of all of this, because a lot of these other things, the other treatments don't really work anyway. So that's really why it's going this way.
So this is called acoustic wave therapy. And, we know what it looks like because we've used it, but people out there don't really know what it looks like. So could you describe what this looks like and what this treatment is like, and so that they can have a mental picture? And then you could always go to our Facebook page and see a video of it also.
Well, it looks like a little bit of a gun, almost, the device. And
we are out of time.
We are out of time.
Well, anyway, go to Recharge Clinic and Ocala's Facebook, and you can see videos of us using this for cellulite and muscle pain. So come see us at the clinic or check out our website, rechargeocalaclinic.com, where you have 2 locations in Ocala, and come say hi. Have a good weekend.